Oh, and Rosa, can you please ask a new patient to come, okay? Yes, thank you very much. Hello there. Yes, please sit down and tell me your story. How have you been feeling lately? In terms of everything, physical activity, the level of energy you have, also your stress situation, work situation, parental situation, leisure time. Is this what you are concerned most? And how do you sleep? How many hours? Well, I mean, it's not normal to have that feeling in the heart center, right? But it's a sign that asks for your attention so that you start understanding where your system is lacking energy. Okay? I'm speaking very broadly. Of course, we will take a look at you medically as well, but you will hear, I guess, quite interesting information about you today. Okay, do you maybe know your weight and your how tall you are? Your height exactly? Okay. And yeah. Okay, good. Just putting all in the system. Any allergies that you are aware of? Yes, sometimes it comes that, people are thinking that they do not have any, and then they have some chemical components and they get allergic reactions. Even though we are not going to work with any chemical compounds, but just to understand as much as possible your whole situation. And what about any chronic illnesses, disorders, teeth situation? Okay. So is this the only symptom that makes you anxious, or there is something else that you would like to add? Unless, as you are here right now and you can use this opportunity. Okay. Good. I want you to relax, there is nothing, no role that you should play here with me. Any information that you will know today, any information that will be new for you, it's just for your own interest. Take a look at this as this is something new, something interesting, something that broadens your understanding about everything. Okay, so what I'm going to do, at first I'm going to sanitize my hands, okay? And just so that you would be more comfortable, more trusting, okay? All right, just could you please open your palms like that, okay? Okay, so I'm putting my palms on yours, okay? You can close your eyes if you would like to, and I will just connect a bit, okay, to your energy. You can take a deep breath in. If you feel, you can exhale through your mouth. Yeah, just like that. It's all correct. Okay, now I'm placing my palm, one of the palms, on your heart. Okay, you just breathe normally. Okay, I just want to feel your body rhythm, the way you breathe, how the energy is circulating in your system. At this very moment, of course, at this period of your life, because we definitely feel different at different stages in our life. By the way, what is the exact age of yours? Okay. Do you know that every decade we step into a different rhythm of our life? Different stage, and thus each stage requires different capabilities, different rhythm. That's very normal. Now what I'm going to do, I'm going to place my palms. You can just rest your arms, right? I'm going to place my palms on your shoulders, okay? Here. Okay. I feel that they are a bit tense. I can see like here, okay? These parts, they are heightened. Okay, so now I'm going to press. It means that it may really hurt you, okay? Okay. Yeah, I just want to check this. Okay, I will just mark some things, okay? Just a moment. I will take a meeting. Yeah, just stay still. All is okay. I'm just getting familiar with your body. I will just measure these tensed points. Just again a bit palpate that part of your neck and your shoulder. And measure a bit. 3.7, yeah. Okay. Now the other side. Alright. Yeah, again, just palpate to fix if there is an exact points or tense. Okay, and here 3 and 3 and 9. Good. Do you have any pain in your back? Okay, I will touch gently your face right now, okay? Like the ears, okay? Yeah. Just if you could, a bit lift. Like that. Yeah, that's okay. I will also put my palms on your head here. Okay. A bit. Okay, and then check your skin. I will need my light pen. can close your eyes, yeah. We'll be just touching and checking if there is any coloration like that. It seems quite good. What is the network of your blood vessels and your everything? Okay. Okay. How often, how often do you feel that symptom in your chest? And is it moving, or it's in the center of your chest, or is it in the one side, the other side? It depends. Is it dependable on a movement? All right, and how would you describe those kind of symptoms? A pain, if that's a pain, is it dull or sharp? Do you have any, it's a heaviness like you cannot breathe? Have you tried the relaxation techniques, the breathing techniques, just to calm your mind? And the symptom, is it changing then? So let me repeat so that you could clarify if I understand right, okay? So it seems to you that there is a heaviness on your chest, so you are getting anxious that something's happening with your heart because you have a heart condition. Yeah, but no symptoms you have experienced before. So it seems that because of that heaviness, it's hard to breathe in as much as you would like to, but when you start doing breathing exercises, you see that you can physically take that air, right? Yeah, we will try. I just get to know your body first, and then we will try to take a look a bit at the energetic perspective of it, okay? Because our body is not only, hands, skin, organs, and the skeleton. Our system is kind of huge, and sometimes it experiences some breakdowns. But that's very good that you came here for the relaxation, for the calmness of your mind, so that when you could understand what actually is happening with you, then you will be able to understand how to deal with it and what exactly you need to solve here. So, no need to take off your shirt, that's fine. I will use my stethoscope just to really understand what's going on. Okay, I will warm it up a bit. Okay. Putting it on your chest. Just breathe normally. You tell me please if you feel any discomfort. Just want to understand your heart rhythm. Are there any other noises around your heartbeat? Okay, the side of it. Do you have any physical activity? you briefly explain me what is your diet? Okay, now a bit upper side here, okay? Please take a breath in and breathe out. One more, slow, deep breath in. Breathe out through your nose, calmly, slowly. Okay. Now, what about the water? How much water do you drink in a day? And do you usually prefer water, or you choose some other liquid? I'm going to push a bit, okay, your chest. If it will be painful, let me know, definitely. I will be soft, I promise, but just to see your body's reaction, okay, to some points. Good. Okay. Here. Okay, and no pain here. Good. Here. Okay. Have you got any infections recently during the last year? Okay. You know, as this is your very first visit, I'm really trying to understand what's going on with your system, but mainly, you know, we should speak about the health, you know. It's very interesting breaking point for your brain and for your thinking patterns, but yeah, well, we will try to do something like that. So can you please tell me, when was the last time you have felt that you are really healthy? You are strong, you are calm, you are energetic, you know. Do you remember that moment? And how was it? What you were doing during that time? How do you think? Why you felt the way you felt? Would you consider yourself as a person who fulfills his dreams? Are you currently working on your one of your dreams? Or maybe you remember the time when you were when you have fulfilled your dream. Yeah, this is some kind of a therapy, you know. You can tell me everything what pops into your head, because you know the way we align, our energy fields are aligning. It's also important. I also would like to ask you, how do you feel right now? Okay, so my dear, what I'm going to do right now, I think I'm going to check your eyes, all right? So it will be a strong light. Please excuse me. Okay, but I need to take a look. Okay, coming closer. Yeah, if you could just hold for me. Your eye open. Okay, good. Alright. If I ask you what kind of color your eyes are, what you would name it? Yeah, it's very interesting, you know, because when we speak about iridology, sometimes people are having like 3 or 4 colors in their irises, but then it seems that all of this is just the signs of the infection, of inflammation, of stagnant livers, and so on, you know. So that's why I do ask. Okay. And now the other eye. Right. Okay. Good. You may open and close. Open and close. Relax. Relax your vision. And I think what also I would like to do I will ask you to show me your tongue. Okay. I see. Okay. When was the last time you were consuming any I don't know, supplements, any medicine, antibiotics, something with a chemical compound? All right. Okay. What I would like to do right now is I will palpate, okay, your skin. It won't hurt. Just at some points this will be as the stimulation, but at the same time here. Okay, now we'll go to your chest, okay? It's like some kind of a work on your meridians, but at the same time I'm checking your sensations and the way your nerves respond, okay? Can you please again open your palms just like that, but rest your arms to the sides. Ooh, that was very nice reaction. Yeah. Okay. I will also go through the points that aligns your heart and your kidneys, okay? But just on this side of your arm, okay? So if you could rest it on my hand right now. Okay. Relax it, please. Totally, just put all the weight on my palm. Good. And now I would also like to see your joint, okay? On your... just straighten, please, your both legs. You usually like to sit with the crossed legs, right? Okay. Well, that's very important also, the way you hold yourself. I mean, your posture, because when you have the vertebrae that are not in alignment, it means that the energy cannot go through the channels. And also it has, you know, what to do with the pain in your chest that you experience sometime, because just your nerves get the inflammation. But now your legs, I would like to, okay, this leg, okay, this side, also the knee, okay? Okay, relax, you can close your eyes, yeah? Okay, now here, okay, good, okay, okay, good, okay. I could prescribe you a kinesiologist or, you know, someone to work with your posture, but I don't want that it would be too much for you. And I just want you to start loving your body the way it is, you know, because it is perfect. It shows all your emotional stability, instability, all your defenses. Yeah, because you've got surgery, so this side, you know, it starts to compensate the other side on which you have the scar, you know. All the fascia and all the muscles, they are also tightened, you know. It's a lot what you can do physically, at least, but you know, it's all in different levels. Okay, so I want also to check your here again. Here, how do you feel? All right, just a bit. Yeah, good. Okay, you want to... Okay, it's hard for you to hold like that to your head, I see. Okay, no problem. Don't worry. Okay, and I think the last thing that I would like to do, I'll use this beautiful frequency and sound, and I'm going to again work here with your tension, okay, because this tension may provide you that pain and discomfort in your chest also, even though I would say this is more about your emotional situation, the way you have explained me how you feel at work regarding your dreams, your stress levels. Putting here, you feel the vibration? Okay, good. Yeah, these are the exact points that will get stimulated and can help with the energy movement, energy flow. But you know, it's more like temporary. It's not long term, I mean. Okay. And this side will go like that, okay? Or, okay, it will be more comfortable with the, yeah, if you could, would you turn a bit your head? Okay, so yeah, because you're here and everything, and I will go with this arm. You like the sound? Good. Again, I'm just thinking that I can also prescribe you I can test you energetically, but I think for today it will be too much. Alright. Good. So, my dearest. Yeah, you can. You can go back. Okay. Yeah. Good. So, what we are going to do. I think I will make an appointment for you. One more appointment for the next time, where we could work more energetically, okay? Already knowing your situation. If during the period that we will not see each other, you will feel that you need more help, you may work with a psychotherapist, okay? I'm going to give you a list of really, really valuable contacts, okay? Yeah, so here you go. We'll put it here, okay? You can take it with you. And then I would like also to, just let me see. I think maybe in 2 weeks. How would that sound to you? Or I could already prescribe you something. Yeah, because we can, test energetically when you are not physically here, the physical space between us is not a matter of fact here. So, good. Because, it will take some time. Okay, I think we could. What about the evening part for you? Is it okay? Yes. So I think maybe I could send you directly to the person who creates, these. Let's call it homeopathic treatment. Okay. So in 2 weeks, the evening time, all right? Yes. Okay. So here also I'm putting, okay, so that you will remember. Right. Do you have any questions? How do you feel right now? Definitely you can go directly to your rest. That's fine, yeah. You can go to sleep. Even, when you are sleeping after important occasions, after important understandings that you get, it's like your brain is working even better. It can, how to say? I forgot that word. Okay, I will try to explain. It can just understand better what happened, okay? And then you get better results, of course. It was a pleasure for me to talk with you today. Yeah, all is related, yes. Don't think too much. Just go home and relax, okay? At your safe space. Okay. Thank you very much. See you next time.